I won't go through all of these anymore because many of these are just very intuitive. I'll focus more on the ones that really stand out, particularly again, smoking interactions. These are true for two of the three pines, clozapine and olanzapine. In fact, the smoking interaction is so significant that smokers have their blood levels of clozapine and olanzapine cut by up to one half. Ganun siya kagrabe. That's how intense it is. Conversely, again, if you have smokers, existing smokers taking clozapine and olanzapine, and then they stop smoking because the CYP1A2 induction has stopped, CYP1A2 levels go back to baseline, clozapine and olanzapine levels will rebound. Conversely, they will increase. It may go into toxic levels. So, again, you do not just resolve this by telling someone to stop smoking. Because if you just stop without proper adjustment of dosing, the blood levels will rebound, toxicity. So this is really a delicate thing. You need to coordinate with the team on that. Okay, so it's not very straightforward. And again, it's the smoke, not the nicotine. It is the polycyclic aromatic hydrocarbons. The SSRIs, yeah, again, so I mentioned that second gen, third gen antipsychotics are frequently used as adjuncts in unipolar depression. So you would expect to see this combo actually with SSRIs. But why is there a risk of psychomotor impairment? So I did mention earlier, right? 5-HT2A receptors can indirectly modulate dopamine release. And 5-HT2A receptor antagonists can lead to downstream dopamine release in the nigrostriatal pathway, displacing dopamine 2 receptor antagonist, excessive D2 receptor blockade in that pathway, so less EPS. But what happens when SSRIs, they increase serotonin in the synaptic cleft. The serotonin will then bind to the 5-HT2A receptors as agonists, as endogenous agonists. So we lead to an opposite effect. So actually, uncommonly, I've seen this in the email groups through our email listserv. There have been reports of people experiencing tremors, in fact, with SSRIs. That is actually one reason. Because again, serotonin is not just about mood. It does so many things. One of them ties into motor function, actually. So this is one thing. I mean, keep an eye out on it. Might as well, right? Might as well. Once again, false positives, please watch out for them. They're just, yeah, the rapid urine drug test is just a really, really bad test. It's really, really bad test. I mean, it has its niche uses, but it's an absolutely garbage test, actually, in general. Especially in terms of specificity,